Good afternoon, everyone, and welcome to the University of Manitoba Alumni and Friends Virtual Learning for Life Alumni Scholars Series. My name is Tracy Bowman. I'm the Director of Alumni Relations here at the University of Manitoba and a proud UM alumna. And I'm also today's moderator. So thank you for joining us and for making this part of your day. As we've mentioned over the last several weeks, this series of the Virtual Learning for Life program is especially exciting as we have the opportunity to profile many of our University of Manitoba alumni who are doing absolutely amazing things and excelling in every sector imaginable all around the globe, proving that alumni are one of the finest examples of how a degree from the University of Manitoba helps better our world. So just a few housekeeping details before we get in today's discussion. I introduce today's speaker. So you're viewing all of this on YouTube and we are recording the session. And as per usual, we will send you the link so you're able to view this as many times as you want. If you want to send it to friends and family, it will be posted on our website for some time. We are also using the platform Slido as we normally do. So that is www.slido.com. And this week's password is VL10. And I encourage you throughout the session to ask your questions, post comments. I'll always be looking at that. And as per usual, we'll be putting it up, especially at the end of the discussion during the Q&A portion, so everyone's able to see those questions. But please keep them coming throughout the presentation. We always try to get through as many questions as we can. So now I'd like to introduce today's speaker, who is Dr. Gigi Osler. She's a Max Rady College of Medicine graduate from the class of 1992, and she'll be speaking on the topic of hot health topics for 2021, and there are many. So let me just tell you a little bit about Dr. Osler before we get started in our discussion today. She is an assistant professor at the University of Manitoba, and we talked a little bit about the formal name of her department, but we're going to call it ear, nose, and throat. She's a physician in that area, as well as I mentioned, she's a professor at the University of Manitoba in that area. She is also the first female doctor from Manitoba to hold the role of president of the Canadian Medical Association, which was just a recent role. Healthcare also runs in her family. Both her father was a doctor and her mother was a nurse. And she's also one of the 2020 University of Manitoba Distinguished Alumni Award recipients in the Professional Achievement category. And you may have seen her on Instagram. She's very active on a variety of social media platforms, sharing her wealth of knowledge as a physician on a number of topics, particularly with COVID. So Gigi, welcome. Thank you so much for taking the time. And why don't we just dive right in? So as we were mentioning just before we started, it looks like you are at the hospital. Looks like you're at your office in your lab coat. So do you want to share just a little bit about sort of what your day-to-day has been during this whole global pandemic?
Thanks, Tracy. And it is just an absolute honor to be with you here today. And I am at my office, which is located right across the street from St. Boniface Hospital. So I have a beautiful view of the main entrance. In the afternoon, I get some sunshine. And, if you ask anybody in healthcare what their experience is like, it is night and day different over the last year. And I know many use the term unprecedented. We're living in unprecedented times. We are coming up to a year tomorrow from when the WHO declared COVID-19 a global pandemic. And I remember a year to that day sitting at this desk on my laptop, because I would listen to the news updates over my lunch hour. And I heard them declare it a global pandemic. And at that moment, something clicked in me. And I had been hearing about the pandemic or about the virus for weeks and weeks. But it was, I think at that moment, I knew something big was happening, was going to change. And I still, looking back 364 days later, I still don't think I could comprehend where we are still right now as a city, as a province, as a country, and as an entire world. It's just mind-boggling to think back, almost how carefree life was 365 days ago.
hmm And recognizing you're a physician in Manitoba, so the Manitoba experience is one, and we have alumni from all over around the world who are joining us today. Do you want to tell us a little bit about sort of what what you've been dealing with as a physician in your area in COVID, and what you've seen at the St. Boniface Hospital?
So it's really interesting. And I'll say, my day-to-day life has changed with different leadership roles with the CMA, in that it's allowed me to see some of the day-to-day work that my colleagues are doing and working through, and then some of the higher level discussions that are occurring sort of at those national tables. And this has been a marathon and a sprint all at the same time. And I think when I look back to the spring and that first wave, when we didn't know what was coming, people were just going all out sprint, trying to get ready, completely trying to prepare for what we thought would be the worst. And, we saw reports coming out of other countries, Italy, Spain, New York, and you thought, not here, not here. And if you look at some of the graphs of COVID cases over the last year, that first wave in the spring, far smaller than I think anyone had thought would be coming, and certainly much smaller than our second wave. And so we got through the first wave. Summer was quiet, particularly here in Manitoba, and I was excited. And I think I had tweeted out at one point that we went about 13 days straight with 0 cases. And it was just a nice break. And then fall came and the second wave hit. And so, I see how healthcare providers, and I'm talking about everybody working in healthcare, and I'm including nurses, personal support workers, people working in home care, long-term care, really have been going all out without much of a break, particularly since October when our cases started to go up again. And people are really tired and really exhausted and really hoping over the next few weeks and months we can get the vaccine rollout a little bit smoother, get more people vaccinated, keep our public health recommendations in place, because I see it as this ongoing challenge between getting more people vaccinated and keeping the virus at bay and continuing to keep up masking, physical distancing, and all of that. That is that tension and that dance that's going to occur in Manitoba and across the country over the next few months until we can reasonably say the pandemic is over or close to being over.
Mm-hmm. That dance is really interesting, as you're mentioning, because I was just seeing on the news last night, they're saying even for people who are fully vaccinated, you still wear your mask, still keep the physical distancing, still listen to the health orders, don't have more than whatever each province is, what their health orders are in terms of number of people in your home. So you still need to do those things in order to keep it at bay, right? I mean, you've been vaccinated, but I guess you still don't know. So it's a difficult message for people to hear, and especially to think we're going to get it on the other side of this eventually.
Well, I completely agree. And I will say, this is a novel virus. So it's a novel virus to humans. It's a novel virus to the world. It's behaving in global pandemic fashion. And in the spring, when a lot of this was very, very new, the knowledge was evolving and changing. The recommendations were evolving and changing. And people sometimes would interpret that as public health officials don't know what they're talking about. One day it's don't worry about masks. 2 months later, it's everybody's got to wear a mask. So what's right? And I think we as humans want certainty. We want to know, okay, this is the way it's going to be. But with a novel virus in a pandemic, the knowledge that we have is constantly evolving and changing. And I think we've all gotten comfortable understanding the rationale between public health recommendations and masks. And now what I hear a little bit is, what about people who are vaccinated? What can they do and not do? Can they transmit the virus? Don't know yet. Can they still get COVID? Yes, and I think we've seen even in Canada some cases of it in a personal care home in BC. Are they likely to get severe COVID or die? No. The trial data tells us that the vaccines are very effective in preventing severe COVID and death, and they're very effective in reducing hospitalization. But you still potentially could get a mild case of COVID. You still possibly could transmit the virus. We're still learning all of these answers as more and more people are vaccinated. So you see countries like the United States where the CD has said, if you're vaccinated, you don't need to wear a mask. But Canada hasn't taken that step yet. And so I sense people still are unsure. And I just want to reassure everybody, it's not that I think our public health officials don't know what they're saying or don't know what they're doing. They're constantly looking at the evidence. They're constantly reevaluating risk and adjusting recommendations for cities, provinces, and the nation. So it's this continuous evolution of learning and readjusting that we're going to continue to see throughout 2021.
Mm-hmm. So so first I just want to mention thank you to Bob, who on Slido pointed out that the password is VL10. So it was VFL10 or something anyway. So it is VL10. So many apologies to everyone, and thank you, Bob, for pointing that out. So please keep your questions coming for Dr. Osler. But let's talk about vaccinations. We know that there are 4 vaccinations that have been approved by Health Canada, and some are on the way as we speak. So can you, there was an article in the Free Press that was talking about all 4 of them. And, I would love to hear a little bit more about what's the difference between all 4 and, should you be taking one over another? And there's so much out there. It's hard to know what information to listen to and what I should be thinking is best for myself versus others. So are you able to share a little bit about that?
Let me share my perspective. And I'll preface this by saying I'm not one of your public health officials. I'm not a virologist, but I'm going to explain the vaccines in a way that I think about it with my medical knowledge, but hopefully in a way that's a bit more understandable. So we've got 4 vaccines now approved in Canada: Pfizer, Moderna, AstraZeneca, and Johnson & Johnson. All of the vaccines have been proven to be very effective in the trials to prevent severe COVID illness and death. Real world data is even better than what was seen in the trials now that more of the world is getting vaccinated. And so the real world data really is showing how vaccination can change the pandemic trajectory for a country. The vaccines are showing effectiveness against some of the variants as well, because I know that's a concern. Will the variants take hold before we get more people vaccinated? So the vaccines are showing efficacy, varying degrees of efficacy against the variants out there. And the public health recommendations are also showing continued efficacy against the variants. So I don't think we're going to see physical distancing, masking, hand washing, staying home when you're sick. I don't think we're going to see those recommendations change anytime soon. So as a country, the federal government has a National Advisory Committee on Immunization, so NACI. And this is a committee that advises the federal government on immunization, on vaccines, how to prioritize the vaccines. Within each province as well, each provincial government who will administer and deliver the vaccines also has a task force looking at how do you prioritize vaccine delivery to different people. I don't think we as citizens are going to have a choice in terms of, I'm going to go to my doctor and I'm going to sign up for this vaccine, but I don't want that one. Right now, of the vaccines, if I speak for Manitoba, of the vaccines that we have available, Moderna and Pfizer, the Moderna vaccine is the one that does require freezer storage, 2-dose, that is being prioritized for different communities, particularly up north. The Pfizer one, really, that's the one that requires the ultra cold storage and those special freezers. Also two dose. That one is being given at the different super sites or super centers. In Manitoba, and it's Thursday, it's Wednesday, it's March 10th. And as we are speaking, there's a press conference being held. And what should be being announced, and normally I would be watching it, is an expansion of the criteria, the eligibility criteria for vaccines, because Manitoba and the other provinces should be receiving the first few doses of the AstraZeneca vaccine. And this vaccine is that's one you're going to be seeing delivered at doctor's offices and pharmacies. So I saw earlier this morning in Ontario, select Costco and Rexall pharmacies will be giving out the AstraZeneca vaccine. 2-dose. In the trials, and people have pointed this out to me, in the trials had about 66% efficacy in preventing severe COVID illness. But the real world data on the Astra vaccine, if you look at Scotland, and at the end of February they published some data. Scotland, which had some of the variants first discovered in the UK, primarily that population received the AstraZeneca vaccine. They noted, with only a third of their population vaccinated, but a 94% reduction in COVID-related hospitalizations. So I think sometimes we get hung up on the numbers, the 66% versus 95%, whereas the real world data is showing all of the vaccines are very effective, and all of the vaccines will be helpful to get us out of the pandemic, to help decrease the strain on the healthcare system. So each province is going to have their own criteria as to which group gets which vaccine and when. And I think what we're hearing right now in Manitoba on March 10th is an expansion of the vaccine eligibility to a younger age group. And within that younger age group, there are priority groups, so that, let's say you've got, if you're a transplant patient on immunosuppressive drugs and you're in that age group, younger than I think 75 is what it is now, or 80, you'll be able to book an appointment to get a vaccine in the next coming weeks. And the Manitoba government has said that, I think they're hoping by about May 18th, all eligible adults will be hopefully have had their first dose or be booked to get their first dose. So I think we're going to see in the next few weeks a real ramp up in vaccinations, not only in Manitoba, but across the country.
Mm-hmm. That's really exciting to hear that. Actually, I'm going to see Chris. Do you mind bringing up Slido? Because we've had just a number of questions come up on this very topic on vaccination. So I'd like to deal with them now. So Bob is asking, Gigi, how do you deal with anti-vaxxers? What a great question.
Yeah, and I'm hearing probably more vaccine hesitancy than outright anti-vaccination feelings. Although there are people who really do not believe in or are against vaccination. And I'll share with you my approach. And my approach as a healthcare provider is to approach it with understanding. And, I don't want to condemn anybody for their feelings one way or the other. I try to provide people with, first I seek to understand, listen, understand where they're coming from. And for a lot of the people who are vaccine hesitant, a lot of the hesitancy is because the vaccines are so new. We don't know what the long-term side effects are going to be. This new technology, I have not heard that it's going to, if I get the vaccine, I'm going to get a microchip implanted. I haven't heard that, although I've seen it on social media. But I think I'm hearing more concerns about the newness of the technology and why was it so rushed. Try to provide evidence, the evidence that can be found out there from rational, reasonable sources. I'm wary of any sources that are too dogmatic in their approach, that are saying 100% this or 100% that, and try to provide compassionate, science-based, evidence-backed information to allow people to make their own choices. And when it comes to why do we have these new mRNA vaccines so quickly? Well, when you're faced with a global pandemic of unprecedented urgency, when you have countries pre-purchasing doses, so providing vaccine manufacturers with hundreds of millions of dollars to ramp up the technology. When you've got scientists all around the world working together, focused on this technology, you'll find things move pretty quickly. And when I look at some of the trial data in terms of how effective the vaccines are, the COVID vaccines are extremely effective. I mean, far more effective than almost any vaccine we have out there. I think measles and mumps vaccines are about 90% effective. So when you're faced with choices like, do I get the vaccine to allow a country to get to herd immunity, to allow us to get back to some semblance of the life we used to have? Will it affect my fertility? No evidence that. Will it make me sick in the long run? No evidence of that. I try to provide people with the rationale that getting vaccinated is the big strategy to move us out of the pandemic. And as a healthcare worker who's already had my 2 doses of the vaccine, I can assure people that I had very few after effects, and I'm confident. And I and my fellow healthcare workers, I think, for the most part, wouldn't put ourselves, we would hold ourselves up as an example to say, we've had the vaccine, and so far we haven't had any side effects. For the trial participants, they are going to be monitored for a full 2 years after the vaccine. So we're going to get long-term data on any potential after effects. And to date, there really has not been anything significant that I've seen in the literature. So, I think having rational, compassionate, empathetic, understanding conversations with people who are hesitant, along with trying to provide them with as many reassurances and as much science and evidence as we can give, is part of the conversations. Because I find when you hit at people too hard with the pushback, it sometimes makes people more entrenched in their beliefs, and that's not what we want with a pandemic. We want to encourage everybody to get vaccinated.
Mm-hmm, mm-hmm. And I'm sure that's probably what your colleague, Dr. Marcia Anderson's in her leadership role in terms of working with communities in northern Manitoba in terms of getting that education out there about the vaccine is very important. Many other questions have come in about vaccination, so let's just jump right into some others. Are the vaccines considered safe for someone with an autoimmune disease? And if so, are some of them better than others with respect to possible allergens?
Great questions. And these are discussions that I encourage everybody to have with their own healthcare provider, because I can provide general advice. I can't give you any specific advice to your particular situation. What I can tell you from what I've seen for the vaccine rollout in terms of who should get it and who should not, for health conditions, because as I said, as more vaccines are available, we're going to see eligibility expand, not only to different age groups, but within each age group, within each age group, there will be subsets of criteria based on your health condition. And so immunocompromised individuals will be prioritized a little bit higher, and the provincial government will provide specific advice as to what that means. So the clinics, the pharmacies, or the doctor's offices that will be providing the vaccines have that list of who fits into priority group 1, who fits into priority group 2, who fits into priority group 3. When it comes to allergies and allergy-related reactions to the vaccines, there have been few anaphylactic, I don't think there's been any anaphylactic reactions to the vaccine. So life-threatening vaccine reactions that I've heard of in Canada. And I know with some of the vaccines, initially it was caution for people with severe allergies. But again, when I look through the list of the vaccine ingredients, it doesn't look like there's no egg in it. There's no, none of those ingredients are shellfish that someone asked me about that. So there's no ingredients that I've seen that should be big red flags. But if you do have a history of severe allergies, make sure you speak with your healthcare provider, and especially let whatever clinic or pharmacy that's giving you the vaccine, make sure you let them know so they can cross-check against the list.
Okay, the next question is, there's a few questions on fertility and pregnancy. So
Yeah.
What are the current recommendations for COVID vaccines during pregnancy?
So that's a good question, and it's one I've heard quite a bit. And the Canadian Society, American Society, British Society, a lot of the societies of obstetricians, gynecologists have come out saying that pregnant and or breastfeeding women should be offered the COVID-19 vaccine as long as there's no major contraindications. So again, I would say have that conversation with your healthcare provider. The potential risks of getting COVID and the potential risks of getting very sick, what we call the morbidity and mortality, are higher compared to getting the vaccine, which is why I'm seeing a lot of these societies recommend vaccination for pregnant and breastfeeding women. When it comes down to fertility, there has not been any evidence to suggest or to show that the vaccines have an effect on fertility. And I've seen and posted different statements on my Instagram from different societies. So again, have the conversations with your healthcare providers. But so far, proving safe for anyone who wants to conceive, proving safe for anybody who is pregnant or breastfeeding.
Okay, great. Thank you for that. There was a few questions on that topic, so I think you've answered all of that in terms of future fertility, as well as pregnant breastfeeding women. So another question is, where do you see the Johnson & Johnson vaccine being used primarily?
I have said, and I will continue to say, that could be a game changer. And the thing with the Johnson & Johnson vaccine that I've seen that could be the game changer, single dose, transported in a regular fridge. And I think I even saw a report saying that once opened and constituted, it potentially could be kept at room temperature for X period of time. So when you think about how do we roll out vaccination to large numbers of people, how do we roll out vaccination to the public, single dose, easily transportable, that's probably the vaccine that could be a game changer. Where could it really be given? I know Health Canada is looking at vaccination for under 18, so for children. If there's any parents out there, sometimes how you go to those vaccine appointments with your children with a bit of trepidation because there's going to be a needle. Other than Johnson & Johnson, all the other vaccines are 2-dose. So this potentially could be the vaccine for children. It could be the vaccine for people who may be in situations where follow-up isn't guaranteed. So people who may be transient, people who may be experiencing homelessness. If you could give them a single dose and know they're vaccinated, that may be where we see the Johnson & Johnson vaccine in use. Because I think Canada's purchased, I saw we pre-purchased about 10 million doses with an option to purchase something like 18 million more. So it could be a vaccine that is used in the general population, and I'm thinking maybe kids, but there's also a lot of other groups of people and populations where it could very well be utilized.
Mm-hmm, mm-hmm. I hadn't even thought of some of those things that you'd mentioned with Johnson Johnson. Before we get to these next two questions, something that I was thinking of is, are you able to speak a little bit more about, and this is a terrible word to use, but the waste, the ones that are not, some of the dosages that are not used, and why there's, again, looking at what I saw in the news a few days ago, the difference in the range in terms of some provinces saying, so far these are the number of doses that have gone unused versus others. Are you able to share a little bit more about that and why that happens, and perhaps why the variety or the differences?
Yeah, I don't have a lot of that information right at the tip of my fingers. I don't. I have seen a lot of recommendations where people will say, get every dose possible, find people. So I don't have a lot of those answers to be able to speak to with any sort of knowledge or authority right now. But I can only imagine if you're working in a vaccine clinic, you are going to do your utmost to get those last shots used.
Great. Okay. All right. Thank you. So some more questions. Okay. So similar to the question we had before about the anti-vaxxers, so how do you combat the misinformation about COVID and vaccines in general, and i.e. claims that the virus is engineered so vaccines can be developed for profit?
Yeah, I have not seen any information in any credible source or outlet saying that the virus itself was manufactured. And I believe in the good of people. Like, I don't know what type of coordination it would take to be a vaccine manufacturer to make a virus because you want to drive profits. I think, and if you read a lot of the experts, they said we're overdue for a pandemic. We had one in 1918. I don't see any credible evidence to support any of those large global conspiracy theories.
Mm-hmm.
I do see a lot of cooperation and collaboration between technology companies trying to ensure the vaccines are produced, but I don't have any evidence to suggest it's a worldwide conspiracy theory.
Mm-hmm. Okay, thanks. Happy to hear that. Why are government dignitaries and ambassadors not required to follow the quarantine, but vaccinated travelers must?
Oh my, yes. I think they should. I think as leaders, you have to hold yourself to a higher standard. And certainly as a healthcare leader, I know, and I, knew right from the beginning of this pandemic that you can't be traveling. So that's Gigi. That's my personal beliefs. I think as leaders, you have to not only talk the talk, but walk the walk. And if my provincial and federal government says no non-essential travel, then I will not conduct any non-essential travel, because I think that's the standard which we as leaders have to follow. I think it's what's needed to get the pandemic under control. So I'll just leave it at that. I'll leave it at that, Tracy.
Yeah,
I just shake my head.
Now, you may have answered this question when we spoke about autoimmune diseases, but the next question is there evidence that any of the vaccines against coronavirus must be avoided in immune suppressed patients?
Not that I've seen. And so some of the recommendations, and we'll know more after today's news conference, but some of the recommendations I've seen have said, if you're receiving a high dose immunosuppressive therapy for your condition, or say a transplant, you're actually included in those priority groups to get the vaccine. Because if you're immunosuppressed, you're at higher risk of getting severe disease or complications from COVID. So you're actually one of the groups of people that we want you to get the vaccine, because we haven't seen any serious side effects from immunosuppressed people getting the vaccine. So it's actually the opposite. If you're immunosuppressed, we would actually rather you get the vaccine and avoid getting COVID.
Mm-hmm. Yeah, no, that makes sense. We talked a little bit about timing earlier, and so not knowing where this participant is from. So the question is, with 4 vaccines in Canada approved now, what seems like the most realistic timeline for most Canadians being vaccinated? So you had mentioned about May at one point,
Yeah.
in terms of Manitoba, right? But this person is saying May, September, even later. I guess, it depends on the jurisdiction, but any thoughts you wanted to share on that?
So our federal government has said that every adult who would like to have a vaccine should have their first dose by September at the latest. I know provincial governments have taken issue with that. I think as we start to get some of the AstraZeneca doses now, plus we've heard that the government we should be getting more doses of the Pfizer one, maybe even the Moderna. So I think throughout March and April, as more of those doses start to arrive in the country and get distributed to the provinces, that vaccine timeline should speed up. And I was just reading last night, the Manitoba government anticipating some of those AstraZeneca doses in the next coming weeks. I think the Manitoba government, from what I read, is saying that if you're in Manitoba, if you're an eligible adult, you should be able to have your first dose by May, maybe June. So I think we're going to see timelines speed up, but again, they're fluid timelines depending on when the vaccines actually arrive in the country.
Right. Yeah. Yeah, no, that makes sense. So this next question, I think, is really interesting, and I know I'd like to learn more about this. So the second dose, approved for 21 days, is now being delayed to give more people the first dose. So what is the maximum effective time frame between the doses?
So the same National Advisory Committee on Immunization looked at this, and they have specified that in the context of limited vaccine supply and looking at real world data that shows high levels of protection from the vaccine 2 months after, this National Advisory Committee has said that that second dose could be delayed up to 4 months after the first dose. And they base that 4-month timing on the real world data, which shows high levels of sustained protection or antibodies, but 2 months afterwards. And then they do some modeling. The thinking is to get the pandemic under control, get as many shots in arms as possible, knowing that more vaccines will be coming down the pipeline. And so now we're seeing, and I think Manitoba's doing it, BC was doing it, you're seeing more provinces adopt that increase in interval time between the first and second dose. So that's the rationale behind it. And they're continuing to monitor the situation, monitor the effectiveness, monitor the number of doses as they arrive in the country. And their recommendations may change if we can get more doses of the vaccines in the country. So again, I think that's fluid. And as long as the science backs it up, as long as we have these experts on this committee advising, looking at the data, advising governments appropriately, I think the strategy to get as many people vaccinated as possible will help.
Mm-hmm. Yeah, no, thank you for that explanation. That makes a lot of sense. So this next one, so Merck's or MRK COVID-19 drug shows promise in mid-stage study. Do people still need this drug after all people get vaccinated? Now, I'm not familiar with this at all. Are you able to comment on that?
Yeah, and I'm not sure what drug they're talking about. And there are multiple different treatments. So not vaccine, but treatments for symptomatic COVID that are on being evaluated through different trials. And so while these medications are still in the trial stage, it's hard to comment. And it's hard to really recommend anything because haven't been approved, don't have the real world data. So hard to say.
Mm-hmm. Okay. All right. Yeah, that makes sense. Should people who were previously infected with COVID-19 get the vaccine?
Mm-hmm. The recommendation is that, yes, if you have had COVID-19, still get the vaccine. But what they're asking is that you, I forget what the time period is, delay your vaccination. So if you had COVID a month ago, don't get it right away. You still have protective antibodies. So there's a time period, and the different vaccine centers will advise you. But yes, if you've had COVID, it is still recommended to get the vaccine. They're just asking you to wait a particular period of time to allow others who haven't had COVID to get the vaccine.
Mm-hmm. Okay. All right, great. That makes sense. So some more questions will be coming through, but maybe if you want to share a little bit about another topic that we hear about, and I'm sure we'll hear more about it as more people are getting vaccinated or making that decision in their head as to what makes sense for them, is, and I don't know if this is the right terminology, but that's sort of the vaccine passport, proof that you've had your vaccinations. So will you be able to travel? Will it be different from country to country? Will Air Canada, WestJet, jumping on a train? Like, what does that mean? So do you want to share a little bit about your thoughts, your understanding, your opinions on that?
It's very interesting, isn't it? And I think just over the last few days, we even heard Minister Haidu talking about vaccine passports amongst G7 countries and how it is, I forget how she termed it, a topic of high-level discussion, or they are talking about it. And we may see vaccine passports necessary for international travel sooner rather than later, particularly if some of the European countries are talking about it, and they may well implement it. And, there are some countries who require proof of immunization to enter for other reasons. So yellow fever, for example. There are specific countries who require proof of yellow fever vaccination for you to be allowed in the country. So this would be sort of a form of that, but certainly on a larger scale. And, I think for Canada to adopt some type of vaccine passport may be necessary if other countries in the world say you can't come in unless you've got proof of vaccination. They may be developing something. So I think there's certainly some logistical issues that our governments are going to have to address. I know I've heard conversations about making sure that privacy is respected. There are concerns about equity because not everyone may be able to get the vaccine at present. Coercion, are we going to see equity gaps widen once these types of vaccine passports are required? I've also seen discussions in that private industry may require passports. So not just countries, but maybe airlines. Maybe if you want to go to this concert, you're going to have to show something, that says you had a vaccine. So I think we're going to see it coming sooner rather than later. I have not heard any specifics about what type of vaccine passport is it going to be. Is it going to be digital? Is it going to be a paper thing? Is it something you stick in your own passport? But my hope is that our governments are really looking at this in a serious fashion and starting to put some of the pieces in place if and when other countries start to require vaccine passports.
Mm-hmm. It really is an interesting discussion, right? Because getting measles, mumps, those vaccinations, you don't really need to show that you haven't or have. But great point about the yellow fever. I had to do that very thing when I was traveling many years ago. So yeah, we'll see what happens as our governments are dealing with this issue. Chris, are you able to bring Slido back up again? We've got a few more questions. So. This is a great segue to another topic that Gigi, you and I were talking about, but is there still a lot of discussion about the burnout of Manitoba healthcare workers, during this time? Have we lost that many to early retirement, stress leave, moving, et cetera, et cetera?
Yeah, I can tell you anecdotally, I haven't seen any surveys of Manitoba healthcare workers, but certainly talking to my colleagues, people were exhausted. And I did a series on Instagram over the holiday break talking to healthcare workers, and they were tired. And, keep in mind, we were still on the upslope, and ICUs were full, hospitals were full, people working overtime. I just saw a survey today of physicians. So, speaking of the physician community across Canada, and about 2/3 are reporting significant fatigue compared to a year ago, and significant concerns and anxiety, again, specifically related to the pandemic and vaccine rollout. So, I think keeping that top of mind as we start to open up, as we start to go to clinic visits and for surgery and for tests more. I think just some understanding that once the pandemic is over, healthcare workers aren't going to be able to take a month off or weeks off. There's a backlog of people who need to be seen and treated, and tests and surgeries done. And so there's a real push to not keep people waiting any longer. And I think we're going to go straight from the pandemic into, okay, trying to catch up on the backlog. What can we do? What can all of us do to help healthcare workers across the province, across the country? I think continue to do what we can to keep the COVID numbers down. So follow local public health recommendations. Please consider getting vaccinated when your turn is near, because keeping the pandemic under control, preventing a third wave, will significantly help a lot of the mental health strain on the healthcare workers and the physical strain on the healthcare system.
Mm-hmm. It just made me think about some of those pleas that we've seen from doctors and nurses through social media, asking people to wear a mask or to whatnot, and just seeing the physical exhaustion, and understanding, trying to, walk a day in their shoes in terms of what they're experiencing in the hospital. So, and in the extreme cases where there was a physician in Quebec who took her own life because of it. It's something that unless you're in healthcare, you probably can't really understand. So, and I'm sure healthcare providers around, healthcare professionals around the province, no matter what area you're in, are getting questions about COVID, whether they're able to respond or not. Whether you're a physiotherapist or even a massage therapist, you're still in the circle of healthcare, right? So,
and I'll have to tell you, people, you had asked about retirement. I have anecdotally heard actually the opposite: people stepping up and volunteering to go be redeployed. Maybe you're a physiotherapist who normally works outpatients, but the height of it, people were being redeployed to different areas. So I was seeing people work outside their areas of training, get retrained to go work in ICU. Now I'm hearing stories of people who are coming out of retirement to be able to work at the vaccine clinics. So, will we see a wave of stress and burnout and PTSD and retirements once the pandemic is over? Perhaps. But as healthcare providers, what I'm seeing right now is more people stepping up than ever before and wanting to work overtime and pitch in, because they know this is when you have to step it up. And I'm not seeing people shirk away, and I'm seeing people, stepping up and helping more.
Mm-hmm. Which is wonderful to see. I mean, that's the reason you got into healthcare, was to help people, right? So, okay, some more questions. Do you envision annual vaccines forever?
That's a really good question. And so what I was going to add, and then I forgot, with the vaccines, we're delaying that second dose. People are looking at mixing and matching doses. So is there any benefit if you get the first one Pfizer, second one Moderna, or first one AstraZeneca, second one Pfizer? We don't know, but people are looking at that. So maybe there could be some benefit in mixing and matching the different vaccines. We could well be looking at some kind of annual booster dose for the vaccine. And so I think all of that is being considered, which really looks to how can we not only get herd immunity now, but how can we really think proactively to keep the pandemic under control in the future. And so it may well be we need some sort of booster vaccine, every year. We don't know yet, but I know that's being considered.
Mm-hmm. Yeah, no, very interesting. I think you've probably addressed this next question, but really it's about the precautions that people should continue to follow after receiving the vaccination. So some of the points here are masks, social distancing, limiting contact with others.
Yeah. And as I think about it more, like I think when I go outside now, if I don't have my mask, well, I'll wear my mask walking into the grocery store or from my office to the parking lot. I don't know if I'm ever going to not wear a mask anymore, especially during cold and flu season. Like it's been so effective. Like the masks, the hand washing, the staying home when you're sick, the physical distancing. Maybe it's something we need to consider in the future for just, seasonal influenza. Maybe something like that can help keep seasonal flu down as well as prevent more pandemics. So certainly this year, I don't think we're going to see public health recommend take your mask off, go party with the vaccinated people. CDC down in the States has issued different recommendations saying if you've received 2 doses of the vaccine, fully vaccinated people can get together without wearing a mask. We have not heard that from the Public Health Agency of Canada. I personally prefer on the side of caution and probably just continue to wear a mask until everything is settled down and gone, but I may wear my mask every cold and flu season.
Yeah. And certain countries, mask wearing is prolific, right? I've been speaking with some of our alumni in Hong Kong, and it's just a general practice. You wear masks often. So I agree. I think we'll be wearing masks for some time. Another question we have is, do you have any information about incidence or severity of multiple system inflammatory syndrome in children post-COVID infection in Manitoba, and what symptoms occur?
That is a good question, and something that I know a lot of my colleagues are following closely. I personally don't have any of that data on hand, so I don't want to speak to it, lest I give out potentially misleading information. But yeah, so certainly MIS is something that a lot of my colleagues are continuing to follow closely.
Okay. All right. Well, we'll keep our ears open for that. Next question, Dr. Osler, in your own practice, have you resumed elective surgeries as more and more vaccines come online?
Yeah, and so across the province, now that we're in this phase, you are starting to see elective surgeries start to resume. What we are discovering when people are sick with COVID, once they're admitted into the intensive care unit, if they need a ventilator, they are staying longer than, say, seasonal flu or many routine intensive care admissions. And so that is why we are seeing, even though our numbers are down and continue to remain under 100, there still are significant numbers of people in hospital, in the ICU. So we are starting to see elective surgeries open up more and more as the weeks go on. But yes, so they're starting to open up more. And I think we're going to see just this sort of slow opening up and catch up in tandem with more people getting vaccinated, cases staying down.
Right. Yeah. Okay. The next question is, it's a point, just a statement is, I just want to say that it's awesome to hear about healthcare workers coming out of retirement. We should celebrate them and all healthcare workers. Agreed. I think everybody would agree. The work healthcare workers, including yourself, Gigi, are doing is just amazing. So thank you for that. Next question is, can you comment on the people post-COVID who have the long hauler experience? Will we have a clinic designated for these people? I do know someone who is a long hauler, no longer ill, but no longer has COVID, but still ill, I guess.
Yeah. And that's a good question. I haven't heard of any specific long haul COVID clinics coming to Manitoba, but it may be. I'm hearing about it in different centers across Canada, the United States. And so there's this condition, which is sometimes called long haul COVID or long COVID. And I think in the United States, Dr. Fauci called it something different, in that after that recovery period, people continue to experience a variety of symptoms, and fevers, extreme fatigue, brain fog, rashes, muscle nerve issues, GI issues that resulted from their acute COVID infection. And so the longer this pandemic goes on, the more information I have seen in the literature talking about it. There's no standardized treatment for it, and that may change. We haven't seen any randomized clinical trials. What I have seen from the literature is that supportive therapy and long periods of rest seem to help with recovery. I don't know if we know right now if people ever fully recover, given that the pandemic is only a year old, but certainly there are people who will recover, but it just seems to take a long, long time. And as more people get diagnosed with long COVID, I think over the coming months to years, we'll know more about the condition and know more about any effective therapies. But yeah, no, for Manitoba specifically, I haven't heard of a long COVID clinic, but there's a lot that goes on above my pay grade.
Another area that I'm wanting to see if we could talk about is something that we've seen through all this is virtual care. And just thinking about, in everyone's work, what stays, what goes, like what's going to continue to happen. So, have you been a virtual caregiver? Like, what are you seeing? And can you comment on what you think the future is going to look like?
Tracy, that is a fantastic point, because if there's one potential good thing to come out of the pandemic, I think virtual care is one of them. So last year, at the height of the pandemic, CIHI, the Canadian Institute for Health Information, estimated that about 70% of all healthcare visits were done virtually. Mm-hmm. Since then, it's evolved and it's waxed and waned. Currently, some of my healthcare visits are still done virtually, and I have a lot of patients. So again, anecdotal information, although I have seen surveys to back it up. A lot of patients really appreciate it, especially living in Manitoba and in the middle of winter for a routine checkup. Mm-hmm. If you can do it with your doctor over the phone or via video and not have to travel cold, icy winter highways and walk out in the cold, many of my patients have appreciated that. What I would love to hear, and this is for everybody who's listening right now, if you put into Slido your experience, any comments, because I hope virtual care is here to stay. I don't think we can assume that virtual care is here to stay, but I would love to hear from people in the comments, their experiences, their questions. What would you recommend to your healthcare provider or government officials to ensure virtual care in some form will stay? Because I see it in the future, not the way we're doing it right now. So in the spring, healthcare providers were advised to avoid in-person visits unless absolutely necessary, which is why so much of healthcare pivoted to virtual. But we know you can't assess and treat everything over the phone. There has to be some in-person visits. And we're figuring that out as we go on. What does virtual care look like? Who needs to be seen? Who can be monitored virtually? Who has to come in person? When do you do that? So we're continuing to evolve it, because I think as we build back better post-pandemic, I would love for it to include virtual care in some form, in some way. Video visits, phone visits, text messaging with your doctor, emailing with your doctor, You know, some of those things that were thought to be impossible before the pandemic now are possible because of the pandemic. And so I think looking forward, I'm really interested to hear what people have to say about virtual care, their experiences, and what do our listeners and our viewers think needs to be done to get it to stay.
Yeah, no, that's a great point. I think there's lots to learn and some feedback to gather. So as we're waiting for that, so do you want to make a prediction as to what our summer is going to look like? Do you think we're going to be able to travel? Do you think we'll have a bit of a summer? What are your thoughts?
Tracy, the last few weeks have made me more optimistic about the pandemic. Actually, no, I'll go back to December. You know, when Health Canada approved the first COVID-19 vaccine, I think that was the first real dose of optimism I had in months, because I was thinking we're not going to see a vaccine until spring at the earliest, and then they announced it in December. I'd like to consider myself an optimist, and I think if we can get more vaccines into the country, get the vaccines into the provinces, get those shots into arms, we'll be able to keep numbers down. Businesses will be able to reopen. Restaurants will be able to open up more. We'll be able to have more of a semblance of a normal life. I think we're going to continue to need to wear masks. I think we're going to continue to need to stay home when we're sick and get tested when we're sick. I'm hoping for a good summer. I really am. You know, I think if we can continue to keep the variants at bay, get shots in arms with following public health recommendations based on how much community transmission is going on, I think we can continue. I'm hopeful we can continue to open up because it's been a long year for a lot of people, and a lot of people have suffered. And I don't think anyone wants it open more than healthcare workers right now.
Absolutely, yes. Just before we conclude, Chris, do you want to bring Slido back up? Because a few people have piped into answering Gigi's point about the virtual visit. So a lot of positive comments here. So I hope virtual meetings stick around for a lot of the things, I guess, that have been mentioned. I love my virtual visits. And then someone put, Linda said, there is someone at the university right now doing a study on virtual care.
I saw that in the University of Manitoba News, and I actually took a little snapshot of it because I want to follow up to see what they're studying. And that's important. So that's being done right at the University of Manitoba.
Yeah, which is exciting. Super. Well, we're just at the end of the hour. So thank you so much, Gigi, for taking the time. Everything that you've shared with us. Not always do we get, an hour with a physician to ask any question we want about COVID. So thank you so much for taking that time. Thank you to all of our listeners for all of your questions. That was a really great, engaging presentation. So thank you, and keep them coming. And if you have more feedback in terms of virtual visits, please do share, and we'll make sure to share them with Dr. Osler as she's asking you for your opinion. So feel free to provide us with those thoughts. So as I mentioned at the beginning of the session, we've recorded this session. We will share it with you so you're able to watch it again and share it with others. Next week, our speaker is another Distinguished Alumni Award recipient from 2020. It is Dr. Judith Bartlett. She is also a Max Rady College of Medicine grad from the class of 1987 and a Faculty of Science grad from the class of 2004. And she will be speaking on best practices in intercultural health. So with that, thank you everybody for spending the last hour with us. Be well, and we will see you next week.